Okay, so next I'm going to show you with my favorite tool, the foam roller, one of my favorites, other than hand weights, how to mobilize the tissue of your legs. So let's start with our calf muscles. So our calf muscles are these large muscles on the back of our lower legs. They run between the bottom of our foot and all the way up past our knee. And we're just going to go ahead and gently, mine are so sore, roll the tissue. You can do one at a time and kind of up onto the teepees of my hands here. Oh my gosh, that's honestly all I can tolerate. I'm so sore there. You could do two at a time. I don't even know if I can demo that. You have to have the strength to be able to lift the hips up off the ground to do this one. Great job. I'm running over her paws. And so about 20 times back and forth on the calves. Next up, we're going to roll our quadriceps. So our quadriceps are those large muscles on the front of our thighs that go all the way up from our pelvis. Well, one of them does, and attach all the way underneath our kneecaps. And so we're just going to lie over the roller and place it on those big meaty muscles. And we'll just roll. And so we're working with our fascial tissue. This can be a really wonderful fascial release technique. If you have difficulty getting into these positions because of shoulder injury or weakness, please do not push yourself. Always consult with your provider first to make sure it's safe for you. There are other techniques we can use to work with the fascia of the legs. This is just a nice, quick, easy way to get to it. Good. So about 20 passes, just combing through your thigh tissue. And then come down off of the roller safely. Next, we're going to work on rolling the IT bands. The IT bands get really sensitive, especially when we overuse the fascial structures instead of having the strength in our outer hips. And so this is an important one for many runners. And so you can come down either onto your elbow, and I'm just rolling the tissue along the outside of my leg from just below the greater trochanter, which is like the bony part where my hip is, down above the knee. I'm not going over any of the joints. I'm just really staying between the two joints of the hip and the knee. Breathing in and breathing out. You also could do this when you are up on a posted arm. The arm is down under you. Going for about 20 passes on each side. Breathing in and breathing out. It's a wonderful tool for your recovery. Again, as long as you have the strength too in your shoulders to be able to support yourself well here. Right, after about 20 passes, I'm going to switch and do the same thing on the other side. Coming down, reversing, same thing. Left IT band. Rolling out. Now, foam rolling doesn't necessarily feel good. It usually hurts quite a bit. Fascial release in general typically hurts, but you feel so different once it's done. And the kind of pain that it is isn't like a deep bone break pain. It's a safe feeling pain. It's sort of like a skin pain almost. It's very superficial. Going for about 20 passes. Breathing in and breathing out. Making sure that you're in your neutral spine alignment as much as possible. Makes it a little less intense on your spine. Good, and after about 20 passes, come down, and we are good to go. Let's do one more. Let's do our glutes. So sitting on the roller, if you can, I mean, you certainly can just sit with your neutral spine and just do some gentle rolling back and forth across the hip tissue. I can feel this on my side. My right side is usually a little tighter. If you want to go a little deeper, you can, you're flexible enough, you can place your left leg, one leg into external rotation. Make sure to flex that foot, lean over onto that left hand to support yourself, and you can just gently rock, passing through the tissue of the glutes on the left side. 15, 20 passes. Keep your abs engaged. Make sure that your spine is as neutral as possible. Shoulder blades are down away from the ears. I can't feel too much on that side. I'm going to do the same thing on the right. Shifting my weight to the right. My right ankle crosses over left thigh. Right hand is down. Certainly can feel a lot more here. This is my tense side. Breathing in, breathing out, going slowly. And then that is it for our glutes on the roller, our IT band on the roller, our quads on the roller, and our calves on the roller, as well as a couple of those back and chest opening exercises. I hope that's helpful. Have a great one.